Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Familial history inheritance. In familial inheritance, mutation in hereditary non-polyposis colonic cancer gene results in Lynch 2 syndrome. In Lynch 2 syndrome, there is 60 to 70% chance of endometrial cancer. The most important gene associated with Lynch syndrome is MLH1 and MSH2 gene. The most common cancer associated with Lynch syndrome is colonic cancer. Second most common cancer associated with Lynch syndrome is endometrial cancer. BRCA1 and BRCA2 are also associated with endometrial cancer, but they are more commonly seen in breast cancer. Cowden syndrome. Cowden syndrome is associated with endometrial cancer and it is seen in 20 to 30% of cases. So, in familial inheritance, Lynch syndrome, BRCA1 and BRCA2, and Cowden syndrome will predispose an individual to endometrial carcinoma. Protective factors of endometrial carcinoma.
thank you and thank you for watching.